My name is Al-Amin Kassam. I'm a consultant trauma and orthopaedic surgeon at the Royal Devon and Exeter NHS Foundation Trust within the Exeter Hip Unit, but also at the Nuffield Hospital in Exeter as part of the Exeter Hip Unit. I was lucky enough that I was fortunate. I got reasonable grades at school, and I was looking around trying to find which career interested me most. I did work experience in lots of different careers, both in the city. And really, when I went to do my work experience in healthcare, I realized what a wonderful speciality it was, both working with totally different groups of people, different groups of patients, and also the fact that no working day was the same. And the fact that every single day I'm learning something new, I'm meeting someone new and different. And that wonderful life experience is unreplicable, in my opinion, in other professions. So I'm incredibly lucky that I love what I do. The easy answer is that I like carpentry and I like hammers and saws, but that's the wrong answer, obviously. I love the immediacy and the fact that I significantly improve patients' quality of life. After a hip replacement, patients suddenly can do the activities they were never able to do prior to a hip replacement surgery, being in significant pain. So the buzz I get when a patient comes in and says they're able to ride their bike, or they're able to run after their grandkids, or able to ride a horse again, able to row the Atlantic in one of my patients' cases. That kind of satisfaction, I don't think any other profession can give you that buzz that you get when you see the gratitude on a patient's face. And that's the main reason I love orthopedics. It's that immediacy and that satisfaction that you get from treating patients. My name obviously sounds a bit exotic. Originally, my great-grandparents were from West India, near just outside Bombay, and then my parents and grandparents moved to East Africa, and then they moved to Essex. And so, unfortunately, despite that exotic history, I'm an Essex boy at heart. So I was brought up in Essex, and I studied in London at Guy's King Thomas's hospitals, where I went to medical school. Lots of rewarding things, working as part of a fabulous team, training, teaching new nurses, new colleagues, new surgical colleagues, new trainees, but most importantly, really giving patients their quality of life back. It really is the most satisfying thing about it, is having a patient who has a poor quality of life because of arthritis in their hip, and being able to allow them to walk again, allow them to do the things they enjoy again, do their hobbies that they want to do. I think every patient doctor relationship is based on trust and honesty, and I think the one thing I like to be is honest with my patients. I like to speak to them on their terms in a way that they can understand, because that ultimately benefits the relationship I have with my patients. That's the real bond that we have, and a contract that we sign to almost between myself and my patients. And having that trust and honesty really helps the patient understand and prepare themselves for their surgery. I think preoperatively, it's really important to counsel patients properly. So we're really going on this journey together to enable us both to have the best outcomes for that patient. So yeah, various challenges at the moment. I'm sure you're all aware, with the pandemic going on, orthopedic surgery has been decimated by the pandemic, especially on the NHS. That's a real challenge. And that's a problem, I suppose, of having what I call a quality of life-based surgery. This isn't cancer surgery. This isn't pediatrics or emergency surgery. It's vitally important surgery. And I will always campaign for my patients how vital this surgery is. And that's a real challenge at the moment, that on the NHS, our waiting lists have gone up significantly, and going to find it very difficult to recover. That's the biggest challenge at the moment. Yeah. Frustrating, difficult situations. It's always frustrating, can be frustrating in theatre and or on the ward, or when looking after patients. I think the key thing as a consultant and as a surgeon, I see myself as one of the leaders of the team. And so it's really important that I convey a sense of calm and a sense of purpose to my colleagues in theatre and on the ward. Me getting frustrated and raising my blood pressure and heart rate, I don't think it's going to help particularly anyone. Most importantly, it won't help the patient. By remaining calm, I like to think I'm a very calm person, and that hopefully conveys that to the team to ensure the best outcomes for my patients. I think the honest is one of the biggest adjectives I can describe orthopedic surgeons. All orthopedic surgeons I meet are incredibly honest. I think empowering, so empower, maybe that's not quite an adjective, but I think we like to feel that we empower our patients and empower outcomes for our patients. And third word, funny, because most orthopedic surgeons I know are incredibly funny. We're generally quite good bunch socially.